Hi everyone, my name is Michael. I'm another member of Project Hype, and we just want to say to thank you, Dr. Christensen, for his great speech. It was really insightful. And then our fifth speaker is Dr. Pierce, a dentist who owns a private dental practice here in San Diego. So, Mr. Pierce, if you want to turn on your camera and start your presentation, and thank you for being here, by the way.
I think you've got my my video disabled. Let me see. There we go. Right, sorry. Back there. All right, how are you guys doing? I'm Dr. Pierce. I'm happy to have this opportunity to chat with you guys today. Talking a little bit about dentistry as a career. I'll start out with talking a little bit first about what it's like to be a dentist, what a dentist does, what day-to-day your dentist is. You guys have probably all been to the dentist. But depending on your experience, if you've had a lot of dentistry done for you, you may have not seen exactly what the dentist is doing all the time. So I'll kind of bring you through a couple hours of what I'm not going to talk for a couple hours. We'll talk about 2 hours of what a dentist does. A little 2-hour snapshot of my day. Then I'm going to talk to you about how to become a dentist, what you need to do starting now in high school and moving through undergraduate and into dental school and residency. And then we'll have a little bit of time for some questions. So let me share my screen here. Excellent. All right, awesome. Okay. So this is what a day working as a dentist looks like. All right, so practicing dentistry, here's the definition of what a dentist is. Evaluate, diagnose, and work with the prevention of and treatment of diseases, both surgical and non-surgical, in the oral cavity. Basically, we are the doctors, both general dentists, which is what I am, and all of the specialties of dentistry of the mouth. And that not only includes your teeth, it also includes your gum tissues, it includes the bones of your mouth, and all those adjacent structures, which kind of moves into the head and neck region. And so while a lot of times we may be focusing specifically on teeth, it's very important that we are trained really in the entire head and neck as physicians. And so, like I said, simply, we are the ones who are in charge of taking care of your mouth, making sure that your mouth is healthy. There are 12 dental specialties. This is kind of a very quick overview of what they are. Endodontics, which is taking care of the inside of the tooth. You might have heard of having a root canal. They're the specialists that will do root canals. Oral and maxillofacial surgeons, they do more significant surgeries of both the upper and lower jaw, the teeth and the gum tissue there. Your interaction with them as a high schooler will probably be getting your wisdom teeth taken out, will often be done by an oral surgeon. Pediatric dentistry, some of you may go to a pediatric dentist still, but that's dentistry in children under the age of 18, but it's often really young children that, 2, 3, 4, 5 years old who really aren't able to behave at all in a dental office. Prosthodontics is replacing large missing tooth structures, missing jaw structures. Orthodontics, which many of you may have experience with, is correcting malocclusion. Sorry for my typo there on correction. It's straightening the teeth with braces. And obviously there's a lot more to it than that, but that's the general idea. Periodontics are dealing with gums and bones surrounding the teeth. Dental anesthesia is administering anesthesia, really just knocking patients out who need to for different reasons for dental for dentistry, in the same way a medical anesthesiologist is going to work during medical procedures. A dental anesthesiologist will often work during dental procedures. Oral and maxillofacial radiology interprets dental imaging. Oral maxillofacial pathology is looking under a microscope at specimens that are sent in by the dentist to determine exactly what lesion is in the mouth. Oral facial pain deals with tooth and jaw pain. Oral medicine is medically complex patients managing their oral diseases. And dental public health is promoting dental health in the community, and that's almost always in an academic setting. And so general dentistry, what I do is I actually practice aspects of all of those previously mentioned specialties. Every single one of those specialties that was mentioned, I do some of that in my practice. Usually general dentists are going to treat the most common problems, and the more complex or rare problems are going to go to a specialist. The most common procedures that I do examinations on patients, I do fillings, I do crowns, I do extraction, that's removing teeth, I do root canals and place implants and restore them to replace missing teeth is a lot of what I'm doing every day. So looking at a day as a dentist, usually I'm going to see 8 to 12 patients in an 8-hour day. And those patients are coming to see me for some sort of specific dental treatment. I also have 2 dental hygienists that work in my office, and they're also cleaning 8 to 10 patients' teeth. And I'll need to spend, 5 to 10 minutes with each of those patients, examining their teeth, making sure that their mouth is healthy as their oral hygiene is being maintained. And then as a private practice dentist, I'm also responsible for running the business of my dental practice, meaning that I need to make sure, simply that the practice makes enough money to pay everybody, to pay my staff, to pay my rent, to pay for dental supplies, and to ensure that, that I have personal income. All of that are my responsibility as a private practice dentist, which can be a little bit different from other types of dentists and from other types of physicians and doctors working in a hospital that may not have those sorts of responsibilities. So I'm just going to go through like what a typical 2-hour stretch of my day might look like. Starting at 7:45 a.m., we'll have a team meeting with my staff, talking about what we're doing for the day. My patients are going to arrive. Let's say my patient needs a crown, which means he has a large broken area on his tooth that I need to make a fake version of the top of his tooth to fix it. I'm going to greet the patient, discuss the procedure, talk about the risks, and then I'm going to administer local anesthesia, which is giving a shot in the patient's mouth to put the area that I'm working at numb. And then I put in here, it takes about 15 minutes for somebody to get numb, so I'll go into my office, I'm going to pay bills that are on my desk, deal with some of the business end of dentistry, and then I'll go back in at 8:20 and I'll see the patients, make sure the patient's numb, and I'll begin to prepare the crown. I'll use a dental drill, remove about 1.5 millimeters of tooth structure. The dangers with that is I need to make sure that I'm not touching the adjacent teeth. I don't want to make sure I'm not touching the lips or the tongue, doing any damage to the tooth structure. And a lot of times the area or my room for error is less than 0.1 millimeters. So it's all very, very technical. I use 6x microscopes so that I can see really carefully what I'm doing with large amounts of illumination. And so then I remove all the tooth structure I need, make sure everything's healthy, prepare the tooth the correct way it's supposed to be prepared. And then I'll take an optical impression of the tooth. I use a 3D scanner to take a 3D video of the remaining tooth. I use a computer program that I upload. I upload that to a computer program. I design the crown. Takes me about 10 minutes. I manufacture the crown. I send it to our milling unit that we have in our office, and the crown's milled. So I'm going to have about a 35-minute break while that crown's being made. Then I'm going to go over to the other side of my office. I'm going to see the 2 hygiene patients. I'm going to do examinations on those 2 patients. Then, I might discuss with a front office staff member our marketing budget, how to increase visibility for new patients, improve new patient experience. Then at 9:20, I'm going to check my fantasy baseball team stats, but it's more of a joke. But I really, you have breaks. It's not like I'm working on stuff. At 9:30, the crown's finished and it's ready for delivery for the patient. Then I'll have put it in the patient's mouth. I'll make sure that everything looks good and feels good for the patient, give them instructions, and then I'm going to leave the operatory and then go see 2 more hygiene patients. And so seeing that as a snapshot, the things I want to bring up is that dentistry isn't just knowing how to fix teeth, right? There's a level of knowledge that's necessary for me to be able to diagnose and look at a tooth and see what's wrong with it and how to fix it. So there's a level of intelligence and knowledge there. But not just that, as a dentist, I also need to have some hand skills, right? I'm working in really, really tiny spaces. I need to be very, very controlled with my hand movements. Mistakes can be problematic from damaging a tooth next to it that I'll need to fix, that'll make an upset patient, that can cause pain. It can also be very damaging if I cut a lip that's very aesthetic on somebody. It can be very, look really, really bad, obviously making an upset patient. I can also, if I cut, there are vessels underneath the tongue that if I were to damage, I could, jeopardize somebody's life. And so it's a little bit stressful that way, but also requires a lot of technique sensitivity. I also, as I kind of threw in a few things there, I'm also running a business. So not only do I need a skill set of being able to, be a doctor of the mouth, but I also need to know how to run my business, and I need to talk to staff members, and I need to be able to communicate with them. I need to get them to work on their projects while I'm working on what I'm doing. I need to manage all of those things is the skill set that somebody who is interested in dentistry is going to want to have, because you could be a absolutely fantastic clinician, meaning your dentistry is beautiful and perfect, but if you're not friendly, if you're not able to communicate with patients, to talk with them, as you saw, there's a few instances where I'm talking to patients. If I'm not able to communicate with my staff members, I'm going to struggle as a dentist, because I may have this amazing skills, but nobody wants me to use those skills because they don't like me, because their patients aren't coming into my office, or I can't pay my bills, so I can't have staff members helping me, and I can't have an office to work in to be able to see those patients. And all of those are important skills to be able to be successful as a dentist. I'm going to show you a little bit of kind of some of what we do in dentistry. Here's an orthodontics case where a patient used Invisalign, which is a clear aligner that goes on your teeth to move her teeth. This is where her teeth started at. You can kind of see there on my screen on her lower right, the patient's right, and if you're viewing, it's on your lower left, where she's got some crowding there, where her teeth aren't fitting together well. And this is just over the course of 9 months. You can see these shots are about every month. That tooth is slowly moving, and those teeth are moving into place. And by the time we finish, her teeth are aligned correctly, so that one, it's aesthetic, it looks nice. But two, it's functional, and their teeth work together well. They're not going to break or chip. There are other things that we do in dentistry that's very, so like I said, orthodontics requires some patience, some being able to be very patient with working with the movements that you're doing. Takes a long time. You can do some procedures that are very quick and complex. This is a broken tooth in the front. You can see that tooth's been broken off right at the gum line. We remove the tooth, and there's an empty tooth hole, and that's right in the front of your mouth. That's on the lower teeth. Nobody wants to have a missing tooth there. So I'm gonna make I'm gonna drill a hole into the patient's bone. It's called an osteotomy. I'm gonna place a dental implant there. That's titanium implant that's gonna actually have the bone grow into the implant and give it strength. And then stay in place. There's a little abutment there that comes up, and then we put a crown on top of that. But all of that, as you kind of look at this image, shows some of the complexity of I need to make sure I put that hole in where I don't hit that tooth on the left and I don't hit the tooth on the right. I need to make sure it goes into the bone and it stays in the bone, both forward and, both from the front to the back and side to side. And then to make sure that the structure fits well and meets the adjacent teeth correctly. And all of those are considerations as we're doing oral surgery procedures. Here's some cosmetic dentistry that's very, very subtle, right? If you look at those two pictures, I didn't have that, I put the arrow on, but I have that arrow there, right? You look at that picture on the left, and well, there's something a little bit wrong with that patient's smile. He has a really old crown that has some decay underneath it, as you see at the edge of the gum tissue. And on the right, I have corrected that and made a much more cosmetic smile. It's very, very subtle, but it's actually a huge difference as you look from one picture to another, where it's a much more attractive and aesthetic smile on that patient. Cosmetic dentistry can also be very, very dramatic. Here's a patient that had years and years of neglect and required crowns on nearly every single tooth in her mouth. This is about 24 hours worth of dentistry spread over 3 days. A lot of dentistry, a lot of complex work there. And actually kind of put a video together of what that particular patient's experience was like.
Dr. Pierce, we actually can't hear the audio. So I think you're going to have to unshare your screen and then share it again.
Is that audio working? Sorry, Darren, what's the fix for me?
You're going to have to unshare your screen and then share it again.
Is it that my audio is running on my computer?
We just can't hear the audio. So I think what you do.
I'll go with mute. The audio is not hugely important. All right, so I'm not sure if you guys had audio there, but either way, you can kind of see what some of the things that go in there. You saw some of the optical imaging I was doing, the computer design that was being done to set up a case like that. And then the most exciting is that huge smile on the patient afterwards, being able to smile again after receiving kind of such complex treatment. So let me talk to you a little bit then to get from where you guys are to where I am, is how to become a dentist. Practicing in dentistry in the United States requires graduating from a US or Canadian dental school. Medicine is similar, but medicine actually allows you to get a degree in some most first world European countries and Australia. The US is very, very strict. You have to have a degree from a US or Canadian school. If you are even a foreign trained dentist from England or Germany, has to go to 2 to 3 years of dental school in the United States to be able to get licensed in the United States. And so the question is then and then I have to pass a bunch of national and state board examinations. So that's the task of becoming a dentist. How do you accomplish that? First, you need undergraduate training. I did my undergraduate training at Brigham Young University. You need a bachelor's degree. And more importantly, you need to take the prerequisite courses during undergraduate schooling. Your major doesn't matter, but it needs to be general chemistry, biology, organic chemistry, and physics. A full year and 2 years of biology to be able to apply to dental school. So each school have their own specific recommendations of classes, but if you were to take all of those classes, you would qualify to apply for pretty much every dental school in the United States. And so a science major is going to make it a lot easier to be able to accomplish that task. Of course, you can major in anything you wanted to. You can major in fine arts, economics, whatever you want. But if you major in organic chemistry, you major in a biology major, it's going to be a little bit easier because the classes you're taking for your major are also the ones you need to prepare for dental school. They're also generally identical to the pre-medical application courses. So you're going to end up taking all your classes with they're almost exactly the same. You'd be ready to apply for medical school if you're also ready to apply for dental school. And then you need to take a dental admissions test. similar to you guys taking the SAT and ACT, which I know this year is uniquely less required, but generally speaking, is taken before you apply to dental school. It includes heavy science portions, which is the bulk of the test, but it also has a science reading comprehension, a mathematics, and then a perceptual ability test before you're to apply to dental school. And all of those are really quite important for your application. And so looking at your application in dental school, most recent application cycles, about 13,000 people apply for dental school for about 4,600 seats. And so it's about a 34% acceptance rate of people applying to dental school. So about a little over 1/3 chance that you're going to get accepted. Those numbers are actually a little worse than medical school. And that's not necessarily to say that dental school is harder to get into medical school. They're both really hard to get into. There's a lot more applicants for medical school, but there's also a lot more medical schools than there are dental schools. There's 67 accredited dental schools in the United States. Most important considerations are your GPA, both your overall GPA, and you'll have a science-specific GPA, which I know you guys don't have in high school, but in college, they'll actually break out your science classes. So you can't have like a 3.8 GPA. Well, you could have a 3.8 GPA overall, but if you got 3.5 or 3.4, 3.2 on all your science classes, that's not going to look as good as somebody who maybe had a 3.8 on all their science classes, and then had a 3.7 or 3.6, a little lower overall GPA, because they really want to know how well you're going to do in your science classes and your DAT score. Those two things are the most important. I'll put a quick pause there. I actually worked as a dental student. They had a dental student on the admissions committee, and I helped out with that. And as you're looking at applying to dental school, I went to UCLA. I mentioned that in the next slide. But at UCLA is incredibly competitive dental school, and we would get at our dental school. There were 88 seats, meaning 88 students would get accepted, and we get about 2,000 to 3,000 applications for those 88 seats. But the first step that would happen is that not an admission committee member, but a secretary would get all the applications, and they would sort them by GPA and DAT score, both science and overall GPA and DAT score. And there would be a cutoff. And it was a little different every year, but generally it's going to be at least a 3.5 overall GPA and a 3.5 overall science, and a DAT score that was in like the 80th percentile. And if you weren't above those numbers, nobody else would look at your application. It wouldn't matter what your extracurriculars were, your volunteering. You could have climbed Mount Everest or won a Nobel Prize. Nobody would know. You would immediately be rejected. And then in those top applications, those top maybe 500 applications would then go to the admissions committee, who would look at the entire application. And so the reason I bring that up is, while a lot of the secondary stuff is really, really, really important, and it's awesome, and it's what gets you into dental school and makes you an amazing, dentist and all those things, the GPA and DAT score, and this is very similar with medical school as well, those are the most important to your application. And so you really got to make sure those are excellent, so that you can show how awesome you are once you get interviews and those sorts of things. And so somebody can look at the rest of your application and see how good your essays are and how interested you are in the profession. But there's a gate you have to get past. And if you can't get past that gate, it doesn't really matter. And so that's why those are so important primarily. And then the other things, extracurriculars, volunteering, essays, work experience, relevant for sure, but they're definitely secondary to at least getting above that threshold. The application to dental school begins after your third year of college, and it's like almost a year-long process. You apply in June, about 14 months before you'd start dental school, and you're going to apply to a lot of dental schools. It's an online application, and it's relatively similar, though each school is going to have a secondary application. But you're going to apply to 20+ dental schools. No matter how great an applicant you are, you need to send, there's a lot of applicants and not a lot of seats. And then you're going to start being interviewed in August, from August to November. During a normal year, you'd fly out. So when I was applying, I flew to 11 different cities over the course of 3 months, and stayed the night and toured the school and interviewed with faculty members. This year, of course, was all done over Zoom. So by the time you guys are doing it, you would assume things would be back to normal. But And then acceptances begin in December and kind of continue until April, until all the seats are filled. It often takes multiple cycles. As you saw those statistics up there, 34% acceptance rate. And so it's not out of the ordinary for someone to apply 2 or 3 years in a row before they get accepted to dental school. And then lastly, those interview skills are very important. Once your grades and test scores get you in the door, you need to be friendly. You need to be able to interview well, present yourself well, to be able to get accepted to dental school. Dental school is a 4-year curriculum, similar to medical school. At UCLA, the first and second years, we actually take most of our classes with the medical school. We would do some dental specific classes, but the bulk of our curriculum was side by side with the medical students, taken with medical school professors. You learn all about the human body systems, how they work, how they break down. Lots and lots and lots of science classes is what your first 2 years are, with a little bit of basic dental procedures in a lab. Then the third and fourth year, you split your time learning advanced dentistry, and then you treat patients in the student dental clinic. And the fourth year, during your fourth year, you take your national and regional board examinations to allow you to be a dentist. After graduation, you can choose to specialize in those specialties I mentioned. It's 2 to 6 years, depending on what you specialize in. And after graduation or residency, you find employment. Many dentists are in a private practice setting like I am. That's very, very common. Unlike medicine, where most physicians are working in a large group setting in a hospital, most dentists work in private practice, whether that's with a small private practice with 1 or 2 dentists. I work with another dentist. She's my wife as well. And that's the most common, but you can also work in public health. You can work in the military. All the branches of the military have dentists that are employed by them. It's also a great way to get your school paid for. There's also large corporations that run dental practices. Those are easier jobs to get. They can be more difficult. They don't pay quite as well, but you don't have to worry about running the business. Somebody else runs it for you. You just show up and work. And then you can work in academia, whether that's research or clinical. And those are the usual options for what you can do. As I mentioned, I'm a private practice dentist. And that allows you for the most control, meaning I can do whatever procedures I want. I have nobody influencing how I practice dentistry. I also can make the most income because I'm able to, running a business, I'm able to run it effectively. If I'm able to do that, I can make a good income. But I also have a lot of responsibilities that all of those other options don't have, meaning that it's, at the end of the day, I'm the last person that gets paid. And if I don't run my business well, I can lose it, and with all those sorts of risks. Any questions? Let me pull up my video panel. Perfect. All right. Is there any questions for me?
Hi, Dr. Pierce. I'm actually hoping to pursue and study dental medicine, specifically orthodontics in college. So your presentation is really relevant to me personally. My question for you is, what has been the most rewarding part of your career as a dentist and healthcare provider in general?
I mentioned it a little bit in that video, is watching patients. You'll have a patient who has teeth like that is really embarrassed, which is funny because I look at 20 or 30 mouths a day, and I've seen, you really can't surprise me at what I can see, but there are people who are really embarrassed about what their teeth look like. It takes a lot of courage for them to come and show and say, hey, like I haven't been taking care of my mouth, and I want to have my teeth back. I want to be able to smile. I want to be able to eat, and do those sorts of things. And being able to have somebody open up to you, trust you to be able to take care of them, and then having those skills to bring them across the finish line and do that is just incredibly rewarding. I mean, you think of all the things you spend your money on, and like healthcare and money is kind of weird friends that interact with each other. But you chew 1,000 times, you have 1,000 meals a year, and there are people who aren't able to do that. And so being able to like bring that ability to them is something that's incredibly rewarding. I also really enjoy, just like on a day-to-day basis, that I'm not, you can get into aspects of healthcare where, like for instance, if I was an oral pathologist, where it's very, 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 very scientific, and I'm just looking at these images on a slide, and I'm trying to decide, oh, is this kind of disease, or is it this kind of disease? with dentistry as a general clinician, or if you're an orthodontist, you're really, not only do you need to understand the science, but you're really, really applying it every day. Of like, okay, I need to understand how these chemicals work, and then I'm actually going to bond them to somebody's tooth. I need to understand why they work, the organic chemistry behind them, so that I can do it correctly, and then I get to actually apply it. And I think it's really rewarding to get to do that.
All right, we have a couple of questions in the chat. They're kind of the same. One of them is there such thing as a public dentistry practice? The other one is, what are the highs and lows of running a private business?
So public health dentistry, like not like a, so there's, you could be a public health dentist, but that's somebody that's working in public health policy. Like I said, they're usually working in a academic setting. Those are pretty rare. It's not a very common specialty. You just have one or two at every dental school. But there are public dental facilities that the government owns. There's they have facilities at with Indian Health Services, and then the county also runs those public health facilities. The benefit of a job like that is it's a little lower stress. You're going to see less patients. But you're gonna have less resources, so you may not be able to do all the dentistry you want to be able to do. You're just gonna be like, for instance, if someone's missing a tooth, if someone's tooth's hurting, you may be able to extract it, take it out to make them comfortable, but you may not have the resources to be able to replace the tooth with a dental implant or something like that. So there's some limitations there, but there are opportunities in public health, but they're also less common. I would say the stats I was looking at is it's about 5% of dentists are working in a public health setting.
I think the last question was, what are the highs and lows of running a practice?
Yes, thank you, sorry. So the highs are of running a practice. The thing that I enjoy most is the amount of control that I have, that I get to see patients the way I want to see them. No one's forcing my hand to work in a way that I'm uncomfortable with, which unfortunately both in medicine and dentistry is always going to be present. And so that amount of control is really, really exciting. And I also get to, I give 10 people a job. And so I have 10 employees, they get paid really well. I hope they really enjoy working for me. And that's really exciting of running your own business, of being able to say, okay, I found, I put out an advertisement for somebody, they needed a job, I was able to give it to them. I was able to hopefully make them enjoy it. And they were able to provide for their family. Is really cool. The lows are, when you as a practice owner, having to deal with the staff, specifically, if they do something in a way that isn't right or isn't correct, having to correct people and having a hard conversation with somebody is really hard to do, and a lot of people aren't good at it. And being able to have that skill set is important, but it's really hard. It's really hard to correct people. And do it in a way that gets the job done, because sometimes they need correction in a way that makes people safe, but also without offending people in that way. And that can be really difficult, and it's hard to do, but sometimes you just have to kind of step up and do it.
Another question just came in, and is, how long do you have to work during the day?
So back to being a private practice dentist, I work as much as I want, which is nice. I actually work 4 days a week, but I work 10-hour days. I prefer that to working 5 8-hour days. And so I get a 3-day weekend every week, but I work really long days. I don't mind it. I'm fairly young, and so I feel like I have the energy to be able to work. But as I mentioned, even as you saw in my thing, I have breaks throughout the day. I'm not like literally constantly drilling on a tooth. I spend a lot of time talking with patients. I'll have breaks in between procedures. There'll be natural breaks where I'm waiting for a patient to get numb and doing those sorts of things. But I like a longer schedule. I enjoy the 10-hour schedule. But the beauty of being a private practice dentist is, like, if I wanted to work, 6 days a week, but 4 hours a day, I could do that too. And all those things are possible.
I think one last question, and is, how does residency work for dentists in comparison to doctors?
So it's very, very similar. The only caveat is that, and while it's true within medicine that you don't have to do a residency, you do have to do a year of internship, similar to dentistry. There's a residency in general dentistry that's just 1 year. But within medicine, you're almost always going to specialize in something. And whereas in dentistry, the vast majority of dentists, I think 85% of them are general dentists doing what I do. So there's a little less pressure in the sense of you go to dental school, you're going to become a general dentist. You're going to be able to practice and get a good job and you know, make money and that sort of thing. Within medicine, it can be difficult and competitive, whereas the types of medicine you do are they have a huge range of what their lifestyle's like, what their income's like. From, you know, being a psychologist is very different from being a brain surgeon, is very different from being a radiologist, and all those sorts of things. Whereas even within dentistry, within the subspecialties, the lifestyle is very, very similar. The income's relatively similar. And so then applying to residency, the difference between medicine is not everybody's applying for residency. Now, some schools like UCLA, Harvard, Columbia, some of the bigger name schools, we do send a lot of students to residency. So while only 15% of dentists are normally specialists, in my class, 60% of my class became a specialist in some kind. And so the things that require you to become a specialist is you need good grades in dental school, similar to, you know, getting into dental school. You need to be able to test well on your board scores and those sorts of things, and interviews in that way. And then, you know, specializing in orthodontics. Orthodontics and oral surgery are extremely competitive. They're the most popular for different reasons. But that's a little taste of that. It's a long conversation. I know my time's limited, so we'll go there.
And just one last question that popped into the Q&A in the chat. Is there any side work that you need to do to properly run your business? And I would assume the question is talking about things that are not dental related that you have to do in order to keep your business making money.
Yeah, absolutely. And that's once again, I talked a little bit about that in my snapshot of my day. Is working on like marketing, which is it's kind of weird, but the reality is there's a lot of dentists, especially in a big city like San Diego, there's a lot of dentists around, and there's a lot of good dentists around. And so being able to get patients to come to your practice, you need to figure out how you're going to do that. And that's a combination of having a website. If you actually look up piercefamilydentistry.com, you can see what our website looks like. I did not make that myself. As we're looking at side projects, I had to hire somebody to come and take videos of my staff, take videos of me, set up a website. I don't have, you know, web design skills. And so being able to learn, I guess the side skill is being able to know what you can do, what you like to do. There's things that you might enjoy in running a business. I like doing the payroll, like the monotonous, Excel stuff's really easy for me. So I do that all myself. I don't pay a bookkeeper, but the marketing stuff I'm not necessarily great at. So I actually hire a company that makes my website, that deals with some of my marketing and that sort of thing. And I outsource that. I also have companies that I also outsource insurance billing, which is super complex. I have a company that we scan the forms and send them off to a company that does them correctly. You know, it cost me a couple $1,000s a month, and I'm so grateful that I get to do it and that sort of thing. So of the side businesses or side skills, it's finding what you like to do, because in dentistry, in running a private practice, there's a lot you can do. But if you love web design, design your own website. If you don't, hire somebody to do it. You know, it's finding what you like to do it, and then being very good at delegating and finding the right people to help you to accomplish those tasks.
Thank you so much for speaking, Dr. Pierce. I really learned a lot about dentistry and how different it is from the medical field, because a lot of people just think that dentistry and getting a doctor, like being a doctor, is kind of under the same thing. And so it's interesting to know that you have to go to a completely different school. So thank you.
All right. Thank you.